I'm Dr. Kavitha Kovi, Consultant Obstetrician, Aster Whitefield Hospital, Whitefield, Bangalore. So today's topic of discussion is recurrent pregnancy loss, or a miscarriage, or abortion, as you guys call it. So this is a worrisome topic, or I would say a worrisome concern for most of you. So one abortion and then all of us are, we are shattered. Arey, kya ho gaya? What's wrong? What happened to me? So is it my fault, or did I do something wrong? So what exactly went wrong here? So that is the question with one miscarriage itself. Let's imagine a person going through 3 miscarriages. So that is called as recurrent pregnancy loss. A consecutive 3 miscarriages is called as recurrent pregnancy loss. So the book says when we have 2 consecutive pregnancy losses or 3 consecutive pregnancy losses is when we need to investigate the person. But depending on the age factor and the concerns expressed by the patient, we do start investigating them a little early. So what is pregnancy loss? And you can have a pregnancy loss at any given point of time, from the beginning of the pregnancy to the end of pregnancy. But the early miscarriages, that means when we have a pregnancy loss before 12 weeks, that is when we do not understand, see what exactly went wrong with me. So why did I do something wrong? Did I travel? Did I eat unhealthy? Did I have a sexual intercourse which stimulated the miscarriage or the abortion? So let's discuss the topic now. Roughly the first miscarriages or sporadic miscarriages are about 15 to 20%. So here we will not know the reason, but most of the times it may be because of the chromosomal problems is what we assume. But will it recur again? Do you think, doctor, I had the first miscarriage, do you think my second one will go well, or will I have a miscarriage? This is the apprehension every mother carries. So roughly it's about 2%. So if you have a miscarriage the first time, what is the chance of you having a miscarriage again? Is roughly about 2%. So what is it that, what happens the third time? Will I have a miscarriage the third time? Yes, sometimes it happens. That is called as recurrent pregnancy loss. And that's when we wake up and see exactly what's happening. So is there anything that we can do to help you? Is there any way that we can help salvage the baby, right? So what are the reasons for the recurrent pregnancy loss? So let's be very open with your doctors when you talk to the doctors about your history. So sometimes you would have gone through a miscarriage before. You don't want to discuss it with the doctor. Please do not do that. Kindly disclose all your history. So the doctor needs to know whether you have had a miscarriage, how many miscarriages, at what gestational period. That means at what time you've lost the baby. You've lost the baby very early at around 7 to 8 weeks, or you've lost the baby after establishing it around 12 weeks, the heart rate went away. So detailed history is very important when you're seeking help. And now how do you recognize? And some of them come into the OPDs and say, no, I've had multiple miscarriages. But when we take a detailed history, all we would realize that they did not even test for a pregnancy. They assumed they were pregnant because they were irregular cycles, and then they thought they were pregnancy and they were losing it. So for all you know, that they may not have been pregnant at all. So a proper history is very important, and an ultrasound, particularly if we get an ultrasound or a blood test or a product testing. That means we send the product of conception for testing, or the histopathology report to identify this as a pregnancy or not. So we need to have any one of these to know that whether you were pregnant at that point of time or not. And then once we first identify, yes, you had 3 pregnancy losses, and then comes the whole point of testing you. So first comes the basic blood tests, and we also look for thrombophilias, we look for antiphospholipid antibodies, we look for thyroid antibodies, any other things, any other antibodies. We just look for these blood tests first, and then comes your diabetes testing. And then we go for any kind of infections, any endometriosis, endometritis, anything is happening in the uterus. And we also look for the ultrasound. So we check the uterus, we check for any abnormalities. So the commonest abnormalities in the uterus that can cause so many miscarriages can be a septum, the uterus is got a partial septum or a division inside the uterus, so that will not allow the baby to get stuck there or continue with the pregnancy. You may conceive and then start bleeding. So that is a uterine septum. There can be fibroids, submucous fibroids, there can be polyps inside the uterus. So these can be the reasons inside the uterus. Before 12 weeks if you are aborting, this may be few reasons, and after 12 weeks to 20 weeks if you are miscarrying again and again, it can be because of the cervical causes or the cervical incompetence. So history, detailed examination and ultrasound are the most important part in recognizing the recurrent pregnancy losses. So when we have recognized the reason, or sometimes there will be unexplained losses, we may not even know what's happening with you, we also ask you for karyotyping. So we may ask you for chromosomal problems. So karyotyping is to understand whether your chromosomes and husband's chromosomes are normal. So generally 99% of the times they are normal, but some of them can have translocations. We call it as Robertsonian translocations. These can cause miscarriages. So depending on the problem, the doctor will suggest the treatment for you, and it can be solved. Most of the times it can be solved. So do not get worried about this. I understand the mental problem or the mental health of the patient when they walk in with 3 miscarriages, but we are here to help you, and seeking the right help and taking the right medications will help you to overcome recurrent pregnancy losses. Thank you. Thank you so much.